We often hear about new viruses emerging. It's important to stay informed about potential health risks. One such virus making headlines is the human metapneumovirus, or HMPV. Recently, China has experienced a surge in HMPV cases, raising concerns among health officials. This essay will provide you with essential information about HMPV. We'll delve into what this virus is, how it spreads, and the symptoms to look out for. Most importantly, we'll equip you with practical tips on how to protect yourself and your loved ones. Remember, knowledge is power when it comes to staying healthy. By understanding HMPV, we can make informed decisions to safeguard our well-being. Let's dive in. HMPV is a respiratory virus, meaning it affects our lungs and airways. It was first discovered in 2001, making it a relatively new virus compared to others like the flu. HMPV is a common cause of respiratory illnesses, especially in young children, older adults, and individuals with weakened immune systems. HMPV is classified as a paramyxovirus. This family of viruses also includes the viruses responsible for measles, mumps, and respiratory syncytial virus, or RSV. While HMPV shares some similarities with these viruses, it is distinct in its genetic makeup and the specific ways it infects our bodies. China has witnessed a notable increase in HMPV cases in recent months. Hospitals have reported a higher number of patients experiencing respiratory illnesses, with many testing positive for HMPV. The outbreak has been particularly prominent in certain regions of China, prompting health authorities to issue advisories and implement measures to curb the spread of the virus. The exact reasons behind the recent surge in HMPV cases in China remain under investigation. Factors such as changing weather patterns, increased travel, and the easing of COVID-19 restrictions could be contributing to the virus's spread. Ongoing surveillance and research are crucial to understanding the full extent of the outbreak and developing effective control strategies. Section 4. How does HMPV spread? HMPV primarily spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets are tiny particles of saliva or mucus that can carry the virus from one person to another. These droplets can travel up to 6 feet and infect others who inhale them. This is why maintaining a safe distance from someone who is visibly sick is crucial in preventing the spread of the virus. Additionally, HMPV can spread through direct contact with contaminated surfaces. When an infected person touches a surface, the virus can linger there for hours, waiting for the next host. For instance, touching a surface with the virus on it, and then touching your nose or mouth can lead to infection. This is a common way for many respiratory viruses to spread, making it important to be mindful of what you touch. HMPV shares similarities in its mode of transmission with other respiratory viruses like the flu and the common cold. All these viruses can spread through both respiratory droplets and contaminated surfaces. However, it's essential to note that HMPV can sometimes linger on surfaces for longer durations. This means that even if an infected person has left the area, the virus can still pose a risk to others who come into contact with those surfaces. This emphasizes the importance of frequent hand washing and surface disinfection to minimize the risk of transmission. Regularly cleaning your hands with soap and water, or using hand sanitizer when soap isn't available, can significantly reduce the chances of getting infected. Section 5. Spotting the symptoms. HMPV symptoms often resemble those of the common cold or the flu, making it tricky to differentiate based on symptoms alone. This similarity can lead to misdiagnosis or delayed treatment, which is why it's important to be aware of the specific signs and symptoms associated with HMPV. Common signs of HMPV infection include runny nose, which can be persistent and bothersome, cough, which may be dry or productive, and a sore throat, which can cause significant discomfort. Fever, which can range from mild to high, and headache, which can be severe and debilitating. In some cases, HMPV can lead to more severe respiratory complications, such as bronchiolitis, which is particularly concerning in young children and older adults. Bronchiolitis is inflammation of the small airways in the lungs, or pneumonia, which is an infection of the lungs that can cause serious health issues. Pneumonia can lead to symptoms such as difficulty breathing, chest pain, and a persistent cough that produces phlegm. If you experience any of these symptoms, especially if you belong to a high-risk group or your symptoms worsen, It's crucial to seek medical attention promptly. Early diagnosis and treatment can prevent complications and improve outcomes. A healthcare professional can accurately diagnose HMPV through laboratory testing, which may include a nasal swab or blood test to detect the virus. These tests are essential for confirming the presence of HMPV and ruling out other potential causes of your symptoms. Once diagnosed, your healthcare provider can recommend appropriate treatment options, which may include rest, fluids, and medications to relieve symptoms. In severe cases, hospitalization may be necessary to provide supportive care and monitor for complications. Section 6. Protecting yourself and others. While there's no specific vaccine for HMPV yet, adopting simple yet effective hygiene practices can significantly reduce your risk of contracting or spreading the virus. These practices are not only easy to follow but also play a crucial role in maintaining public health. These include washing your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public places. This helps to remove any potential pathogens that may be on your hands. Using an alcohol-based hand sanitizer if soap and water aren't readily available. Hand sanitizers with at least 60% alcohol content are effective in killing most germs. Avoiding close contact with individuals who are sick. Maintaining a distance of at least 6 feet can help prevent the spread of respiratory droplets. Covering your mouth and nose with a tissue or your elbow when you cough or sneeze. This prevents the spread of droplets that may contain the virus. And cleaning and disinfecting frequently touched surfaces, such as doorknobs, light switches, and mobile phones. Regular cleaning helps to eliminate germs that may be present on these surfaces. If you're feeling unwell, it's best to stay home to prevent spreading the virus to others. Resting at home not only helps you recover faster, but also protects those around you. Wearing a mask in crowded places, especially during outbreaks, can also help reduce transmission. Masks act as a barrier to prevent respiratory droplets from reaching others, thereby reducing the risk of spreading the virus. Ensuring good ventilation in indoor spaces can also help reduce the concentration of viral particles in the air. Opening windows or using air purifiers can improve air circulation and lower the risk of airborne transmission. Lastly, staying informed and following the advice of healthcare professionals is essential. Regular updates from reliable sources can help you stay aware of the latest guidelines and recommendations for protecting yourself and others. Section 7. Staying healthy in the face of HMPV. The recent HMPV outbreak in China serves as a reminder of the importance of staying vigilant about our health. By understanding how HMPV spreads, recognizing its symptoms, and adopting preventive measures, we can protect ourselves and our communities. Remember, simple actions like frequent hand washing, covering coughs and sneezes, and staying home when sick can go a long way in preventing the spread of HMPV and other respiratory viruses. Let's prioritize our well-being and work together to create a healthier future for all.